Now, quickly look at supracondylar fractures, and here we're trying to look at their clinical features. So, clinical features, of course, is like signs and symptoms. You know what you are picking up. You know, and what the patient is complaining about. So, if somebody has a fracture of the humerus, so down here, close to the ulna and the radius, what are the possible issues this person can be feeling and can be facing? So supracondylar fractures, you should know that they are fractures of the humerus, you know, and often they follow when somebody falls on their hand. So maybe you're falling on their hand and you kind of like break the fall. You understand? You have a supracondylar fracture. So there's a whole lot of issues. So general thing is, if you are trying to ask the person how this fracture came about, they are likely to tell you that they fell on their hand, especially children. Okay. So there's a lot of pain and also swelling. There's loss of function because you're not able to use that hand like you used to use it before. Okay. So local signs include deformity. So there's extension type fractures. So you have an S-shaped deformity of the elbow. Okay, very common. And flexion type fractures, you have anterior displacement of the distal fragment. So on the skin, you have a lot of bruising. There's bleeding into the skin puckering. Okay. So open wounds may also indicate that there's a bigger issue to deal with. Okay. You can also have tenderness. Okay. So that's what we have. Okay. So the fractures, of course, they injure the nerves and also injure the blood vessels. Okay. So, neurovascular assessment, that means if you are suspecting that there is a blood vessel issue, you want to pick up the signs. So, you check if there is radial pulse, usually absent, and the blood supply to the hand is no longer adequate. So, the hand color is actually becoming dull, so to say, pale, and the hand is cold because your blood carried a temperature. Also, capillary refill will be more than 2 seconds. Neurological injuries, okay, so medial nerve injury will give you an okay sign. Radial nerve injury, there will be weak wrist extension and sensory loss on the back of the hand. The ulnar nerve, there's loss of sensation in the little finger and also weakness, okay, in the intrinsic muscles. Okay, so severe or complicated signs, you have compartment syndrome, which will cause a lot of pain, tense swelling, and vascular compromise. Forearm or elbow swelling may mimic dislocation, and also you can have associated injuries like forearm fracture associated with it, and also soft tissue damage. So these are the possible things that you could see in the patients that have supracondylar fractures.